I'd like to welcome you today to Health Maintenance Needs for Pediatric IBD Patients. How can I help my child stay healthy? My name is Maureen Kelly. I am a nurse practitioner in pediatric gastroenterology at UNC Chapel Hill. Part of my role is running a health maintenance clinic for our patients with IBD. I've been doing this clinic for more than a year, and I've learned a lot about how best to manage this part of care for our patients. The goal for this discussion today is for you as parents to understand there is more to staying healthy than just taking the prescribed IBD medications. I have no disclosures. Today, we will discuss several topics as listed on this slide. I'll be highlighting some of what you and your child's healthcare provider can do to keep your child healthy. The goal is to prevent disease-related complications, optimize physical and psychological health, and encourage adherence to the plan, as well as promoting self-management. So what does health maintenance mean and why does it matter? IBD is a lifelong condition that waxes and wanes. It affects not only the GI system, but other areas of the body. It is not only important to keep up with health needs that we are going to discuss today, but continually to monitor wellness, help our patients learn to make good choices, and realize it is a team effort between the patient, his or her parents, and the healthcare team. So the first topic for discussion is bones and eyes. Many patients have bone mass deficits. This occurs more so in Crohn's disease than ulcerative colitis. Adolescence is a time when healthy boys and girls reach most of their peak bone mass. This usually occurs by about age 18. When we refer to bone mass or bone density, we are talking about how strong the bones are. This ultimately determines long-term bone health, including possible risk for fracture. IBD can delay puberty, which is a time of rapid bone growth. It can decrease energy levels, which in turn decrease physical activity, which is important for bones and muscles. May also decrease appetite, which leads to poor nutrient intake. It may keep a child from eating dairy-rich foods that contain calcium and vitamin D. It may lead to poor absorption, and taking steroids for more than 3 months can also affect bone growth. Pediatric patients should be tested for low bone density if affected by any of the above issues. So how can we check and treat poor bone health? The most common way to check bone health is with a bone density or DEXA scan. This is an X-ray of the whole body, which includes the spine. A DEXA scan is going to be particularly important in adolescents who have low BMI, severe disease, or those who are malnourished. Providers may want to get a baseline bone density and then check it every 1 to 2 years. If the bone density is low, the best way to improve it is to get the IBD under control without the use of steroids. Improving nutrition also helps with this. Calcium and vitamin D supplements can help. Encouraging weight-bearing exercise helps as well. Sometimes we refer our patients to pediatric endocrinology for further evaluation. So what about eye health? Some people with IBD develop eye problems. Most eye problems are treatable and do not cause significant vision problems. Eye exams by an ophthalmologist is recommended at time of diagnosis and then every 1 to 2 years. If you notice your child has any vision changes, eye irritation, or inflammation, you should bring it to your healthcare provider's attention and see an ophthalmologist. So what about vaccines? Parents often ask the question, is it safe for my child with IBD to get vaccines? We know that the body's immune system is what keeps you healthy. We know that some of the IBD medications weaken the immune system, which makes it easier for your child to get infections. To protect your child against infections, it's important for them to be up to date on immunizations. And the vaccine recommendations are to follow those of the American Academy of Pediatrics with some exceptions. And the exception is that no live virus vaccines should be given in a child who has had immunosuppressive medication in the prior 3 months or plan to take immunosuppressive medication in the coming 6 weeks. So you want to avoid live vaccines with immunosuppressive medications. And immunosuppressive medications include corticosteroids, immunomodulators, primarily azathioprine, 6-MP, and methotrexate, all the different biologic medications, and then the Janus kinase inhibitors. So what are live virus vaccines? They can cause infection if given to patients on immunosuppression. Some of them only come in the form of live vaccines. Others, like flu and polio, can be given as injectables, which are safe for our patients. So which vaccines are safe for those taking immunosuppressive medications? And that is inactivated or killed versions of the germ. This is a list of vaccines that should be given, including annual flu injection and pneumonia shots, which decrease the risk of upper respiratory infections and pneumonia. Most of these vaccines are recommended for all healthy children and are administered at the PCP's office. The exception to this might be the pneumonia vaccines. So what are special considerations? Your child will likely be tested for hepatitis B before starting a biologic medication. Your child likely received hepatitis B vaccination in infancy, but when we recheck that immunity, we want to make sure your child still has antibodies. If in fact we find out that the child is no longer immune to hepatitis B, then we will give at least one booster of the hepatitis B. Some centers actually give the full series of 3 again. Tuberculosis screening should be done at baseline and annually, even if the initial TB test is negative, while the child remains on the biologic medication. TPMT testing is done prior to starting 6-MP or azathioprine. And we check that to see the individual risk of myelosuppression. And myelosuppression is what causes a decreased red blood cell, white blood cell, and platelet count due to a decrease in the bone marrow activity. And then lastly, the pneumococcal vaccines consist of the PCV13 and the PPSV23. Many of our older adolescent patients did not receive this vaccine as an infant. And so we recommend 1 dose of that for all IBD patients starting at age 6 if they did not receive it previously. at least 8 weeks and less than 1 year later, we recommend giving the Pneumovax or the PPSV23, and then that is repeated 5 years later. So what kind of screening is important to do to reduce the risk of cancer? First of all, colon cancer screening. We know that patients with UC or those who have Crohn's disease that involve more than 1/3 of the colon have an increased risk of developing colon cancer about 8 to 10 years after diagnosis. So screening usually occurs after 8 to 10 years if it hasn't already occurred before that, due to concern about inflammation or mucosal healing. Once it occurs after 8 to 10 years, then usually every 1 to 2 years, unless the patients have primary sclerosing cholangitis or PSC, which is scarring of the bile ducts from liver disease. In that case, they should start colonoscopies sooner. Keeping the disease under control is the best way to decrease the risk of colon cancer, but no one medication decreases that risk more than another. So what are some strategies to reduce colon cancer risks? These tips are for the general population, but they may also benefit our IBD patients significantly. So first of all, testing as recommended, as just discussed on the previous slide, surveillance through colonoscopy. Taking medications as prescribed keeps the disease under control, which also decreases colon cancer risk. As tolerated, a high fiber, high fruit and vegetable diet is also helpful. Some patients have difficulty with that, but if they're able to tolerate it, that's good for a healthy colon. Less red and processed meats, and by processed meats, we're talking about things like sausage, bacon, and hot dogs. Recommendation is to have those no more than 1 to 2 times a week. Maintaining an adequate vitamin D level is also important. Avoiding tobacco if the patient has already started. Certainly becoming part of a cessation program. And then lastly, exercise also helps as well. Skin cancer risk. We see 2 main types of cancer: melanoma and non-melanoma. People that have IBD have an increased risk of melanoma. Anti-TNF therapies also increase the risk of melanoma. Thiopurines, on the other hand, increase the risk of non-melanoma skin cancer, also known as basal or squamous cell cancer. The good news is that skin cancer is very preventable. UV light is the main cause, so we encourage our patients to avoid excess sun exposure and tanning beds. If they have to be out in the sun, application of an SPF 30 or greater sunscreen every 2 hours is recommended. We ask them to have regular skin surveillance with a dermatologist, or to also see a dermatologist if there are any skin concerns at all. Cervical cancer risk. It's not clear why, but women with IBD do have an increased risk of cervical cancer. It's not clear why. The good news is that there is a decline in mortality due to the increase in Pap smears over the last 40 years, from the 1950s to the 1990s. Most forms of cervical cancer are caused by the HPV virus, And the most common vaccine that's given is the Gardasil vaccine. It's recommended for all pediatric patients, and it's safe for IBD patients. It can be given as early as age 9. It's usually given at age 11 or 12 as a 2-shot series. If it's not given till 15 years of age or later, then it's a 3-shot series. It's highly recommended for both females because of the increased risk of cervical cancer, but also males as well due to increased risk of penile cancer. So what are some other considerations for staying healthy? Really important to talk about tobacco use. Current smokers have twice the risk of developing Crohn's disease than those who don't smoke. For someone who has Crohn's disease already, there's an increased risk of flares and need for surgery. This tobacco use cessation applies to both patients and caregivers. Even being around secondhand smoke increases both the risk of Crohn's disease or more severe disease, causing an increased risk for surgery. Anyone that's smoking should enroll in a smoking cessation program, if at all possible. We also recommend that our pediatric patients avoid e-cigarettes, as they contain chemicals that are also harmful to health. What about medication-specific testing? So tuberculosis screening is recommended annually if on biologic medication. And this can be done either through a blood test called quantiferon gold TB, or a skin test, which is a PPD. And there may be more risk due to where the patient was born, where they have traveled, any kind of exposure they've had, both occupationally or otherwise, and communal living. If the patient is on a 5-ASA, we recommend annual urinalysis because it's rare, but these patients can develop nephritis, which is inflammation of the kidney. Certain medications, we recommend therapeutic drug monitoring. And this is particularly important for infliximab, adalimumab, also important for azathioprine and 6-MP. Blood tests are done for all medications, and in addition to looking at things like the sedimentation rate and the CRP for inflammation, we always want to make sure we're getting regular blood counts, liver enzyme tests, and tests of kidney function. Mental health has become more and more talked about in the area of IBD and just in general. Several studies have shown that many adolescents with IBD may be depressed, and somewhere on the order of about 25%. It's not surprising that some patients will find it difficult to cope with a serious chronic illness like IBD. If they become depressed, their anxiety may increase, which can cause their IBD to be more active. Keep in mind that some of the symptoms of depression that are listed here can occur simply because of not feeling well due to the disease. So we as healthcare providers and you as parents should be monitoring this closely. So how do we get help and support for these children? Regular screening for both depression and anxiety is recommended at least yearly. and this is both depression and anxiety. If there are concerns, then we recommend a therapist or a psychologist to see these patients. You can get a list from your health insurance company as to what providers are covered. You can also get information from your healthcare team. Your healthcare team might have a psychologist or therapist on staff or might not, but they can certainly help you find that in your community. You want to look for someone who's experienced in the area of IBD or chronic illness. And in addition to counseling, sometimes cognitive behavior therapy and medications are used, as well as support groups. So, how do we help prepare our children to be able to take care of themselves when they become adults? And this is called self-management. Sticking to the treatment plan or adherence can be really difficult for both children and adults. We know that the treatment plan is not exactly the same from one child to the next, but often includes medications, following a specific diet, and making and keeping medical appointments as they are scheduled. Several ways to remember to take medications may be ranging from simple pill boxes to phone reminders. We know that it's difficult for patients to take daily medication on a long-term basis, and adherence may be difficult. So anything that we can do to support the children and their parents on making sure that this is done each day is important. Other self-management tips include not only keeping medical appointments, but also having our pediatric patients become more involved in their care as they age through adolescence and young adulthood. So we would be remiss if we didn't talk about resources. And I am constantly discovering new resources on the Crohn's and Colitis Foundation website, and they are user-friendly, they are creative, and just really helpful to both me as a provider, but also I know families as well. And just like me, IBD is one of those, and that's a website for teens to learn more about IBD, learn about living with IBD, treatment options, navigating college, and connecting with other patients with IBD. Campus Connection is also another excellent site. These teens and young adults can connect with one another through Facebook. They can learn a lot about navigating college, dorm life, social life, disability or accessibility services, and just how to talk about IBD. Continuing on the foundation resources, every day, Monday through Friday, all day long, there are people manning the IBD Help Center to answer questions. And this could be something as simple as, do you have a brochure on how to explain something to a teenager or a young child, versus, you know, my doctor's recommended this treatment or that treatment. What can you help me with? Can you send me some information on that? So that's a huge resource that we always want to make sure our patients are aware of. In addition to that, there are updated brochures and publications. The one that I use a lot is the Teen Guide, and again, they're user-friendly. They're They're really, really well done, and they're frequently updated. So it's a really good idea to have parents go to the Crohn's and Colitis Foundation website and just look to see what kinds of brochures or publications or fact sheets that they might be interested in. In addition, we always want our families to have support of others in a variety of ways. And this can occur through online support groups, in-person support groups, and then something called the Power of Two program, which is a support program that connects patients and caregivers with a peer supporter. This healthcare maintenance discussion guide is an expanded version of what I've talked about today. So it talks about a lot of what I've discussed, but it also goes into even more detail. It's available online. What I would direct you to is a really helpful checklist at the end of the resource that parents can use to ensure that the child is up to date with all of the things that we've talked about today. What about outside the Crohn's and Colitis Foundation? The North American Society for Pediatric Gastroenterology, Hepatology, and Nutrition, which is abbreviated NASPGHAN, has a goal of improving care for children with digestive disorders. So it's not just IBD, but they do have excellent resources for patients with IBD. The second additional resource is Improve Care Now, or ICN. And that's a collaborative community where patients, parents, clinicians, and researchers work together through quality improvement to ultimately improve care for children with IBD. And this is just a reference list from today's discussion. That is the end of the presentation. Hopefully you have learned some tips on ways to keep your child healthy. Thank you so much.